5 side effects of simvastatin. Have you heard of this medication that is one of the most prescribed worldwide to prevent and treat cardiovascular diseases such as heart attacks and strokes? The main goal of this medication is to reduce cholesterol levels, theoretically protecting the heart. But like any medication, it obviously can also have side effects, some of which are unknown to most patients. So in this quick video, we will talk about the 5 main side effects of simvastatin. I will show you how to recognize them, when they might be concerning, and what to do when you are using this medication. My name is João, Dr. João. I am a doctor, and here I help you take care of your health naturally. Therefore, subscribe to the channel, like this video, and also leave your comment telling me if you have high cholesterol, and if you take simvastatin or which medication, and also from which part of the world you are watching me. How does simvastatin work? It is a medication from the statin class, which is capable of reducing LDL, known as bad cholesterol, and increasing HDL, known as good cholesterol. Simvastatin inhibits an enzyme in the liver that is responsible for the production of cholesterol. And by controlling cholesterol levels, in theory, it also helps prevent the formation of fatty plaques in the arteries, atherosclerosis, thereby reducing the risk of heart attack and the risk of stroke. Who should use simvastatin? Folks, the use of statins, I need to inform you, has been quite questioned around the entire world. So many doctors, many researchers are already looking at simvastatin and other statins with a bit of skepticism. And it's understandable. Why? First, we know, no one here is naive enough to deny the influence that the pharmaceutical industry has on medical practices. This influence is not necessarily aimed at the patient's well-being. Many times, most of the time, this influence is to maximize profits. We see that the level of cholesterol considered normal is increasingly dropping, becoming more restricted, and all of this will increase the number of patients indicated for statins. Okay? Remember, I'm not telling you to stop taking statins or to start taking statins. This is not a medical consultation, and only in a medical consultation can this decision be made. Who should use simvastatin? Patients with high cholesterol, especially when diet and exercise are not enough. Diet and exercise will solve a good part, the majority of high cholesterol cases. The second type of patient, those who have familial hypercholesterolemia, a genetic condition that keeps cholesterol levels consistently high. Also, patients who have already had a heart attack or stroke are recommended to use this medication for secondary prevention. That is to prevent this problem from progressing or happening again. And also patients with high cardiovascular risk, such as those with diabetes and associated hypertension, may also be prescribed simvastatin. What are the 5 main side effects of this medication? First, myopathy. It is muscle pain, weakness, sensitivity in the muscles, which in most cases is mild and known as myalgia, muscle pain. And also, in most cases, there is no significant muscle weakness, but it can be severe. In rare cases, this myopathy can progress to rhabdomyolysis, which is extreme muscle destruction that can lead to kidney failure. And the signs and symptoms include dark urine and intense weakness, a Coca-Cola colored urine. All right? What to do in this case? If you have muscle pain, if they affect your daily activities, consult your doctor. Tests such as CPK, creatine phosphokinase, can confirm if the problem is related to simvastatin. Second side effect, liver changes. Simvastatin can lead to an increase in liver enzymes, indicating liver inflammation. Extremely rare cases may progress to drug-induced hepatitis. What are the signs and symptoms? Excessive fatigue, pain in the upper right abdomen, yellowing of the eyes and skin, which is jaundice. If this happens, get tests done, seek medical attention. If you are using Simvastatin, it is also advisable to measure AST and ALT levels to monitor liver health. If you notice more severe symptoms, do not hesitate to seek help from your doctor. Third side effect, gastrointestinal disturbances. Some patients report nausea, abdominal pain, diarrhea, or constipation. Generally, these symptoms appear at the beginning of the treatment and tend to decrease over time. To reduce these effects, take Simvastatin after dinner or before bed, as this usually alleviates these signs and symptoms. Fourth side effect, changes in blood sugar levels. Simvastatin can lead to a slight increase in blood sugar levels, especially in people with prediabetes or diabetes. It ends up reducing glucose uptake by the muscles and consequently increases insulin resistance, which is bad for people with diabetes or prediabetes. So, if you have a family history of diabetes, if you are overweight, or if you have insulin resistance, you are at a higher risk of experiencing this issue. So, if this is your case and you need to use Simvastatin, regularly monitor your glucose and inform your doctor of any changes. And the fifth side effect is allergies, which are rare but can cause skin rashes, itching, and in severe cases, even angioedema with swelling of the face, lips, and throat. If you experience allergic signs and symptoms such as skin redness issue or facial swelling, stop the treatment immediately and consult your doctor. If the side effects are significant, talk to your doctor. What are the other alternatives to treat your high cholesterol? Are you really engaging in physical activity? Are you really maintaining a healthy lifestyle? Is the solution to switch from Simvastatin to rosuvastatin, which is more potent and less likely to cause muscle pain? Would you want to switch from atorvastatin, which is widely used to reduce LDL, to pitavastatin, which is ideal for patients who are intolerant to other statins? Only the doctor can make this decision together with you. What I can say is that lifestyle is fundamental for controlling cholesterol, diabetes, high blood pressure, poor circulation, and for preventing heart attacks, strokes, and cancer. So, no medication can replace a healthy lifestyle. Metformin does not replace it. Yes, losartan does not replace it. Simvastatin does not replace it. So, the best medicine you can take is to have healthy habits, which I teach you in my book, The Longevity Code. 101 habits to live past 101 years. These habits will indeed help you control cholesterol without medications, without doctors, without tests, and will also help you control diabetes, high blood pressure, poor circulation, overweight, anxiety, and insomnia. So everything you need to have a healthy lifestyle is in this book here. All right? The link to the book is in the description, just like the link to schedule an appointment with me in case you wish to treat your illnesses naturally is also in the video description. Have regular checkups, and if you have any symptoms, make sure to report them to your doctor. Okay? Guys, see you soon.